A sudden impact to a tooth may lead to a horizontal fracture at the level of the root. This type of fracture is classified based on the location of the fracture in relation to the root tip, also called the apex. Horizontal root fractures may occur in the apical third, middle third, or coronal third, which is the third of the root closest to the crown of the tooth. Treatment for teeth with root fractures begins with the repositioning of the fractured segment, stabilizing it with a flexible splint for 4 weeks, allowing time for the attachment fibers and surrounding bone to heal. In the case of a root fracture closer to the crown of the tooth, stabilization may be required for up to 4 months. Root fractures have been known to heal on their own, but these are more likely the type of fractures that occur closer to the apex. The apical portion of the root generally remains vital even after a fracture. The risk for infection of a coronal root fracture is highest. If this fragment should become infected, then a root canal treatment of that segment up to the fracture point would be done to rid the tooth of the infection. Regular monitoring of the tooth vitality with radiographic pictures will let the dentist know whether the root is healing well. Continued annual monitoring of the tooth for up to 5 years is recommended.